going to be discussing on the issue of breast cancer. Please be aware, ladies and gentlemen, that we are going live. So be careful of the movement of your cameras and so on. At this moment, I would like for us to invite our sister, to invite the presence of God before we start. Hello, Sister Emilia.
Yeah, I'm here.
Okay, thank you.
Let us bow. Heavenly Father, we say thank you. We thank you for the time. We thank you for the gathering here. We pray asking for your presence to be into our midst. Lord, I pray that you carry us through the rest of this program successfully. Help us, O God, and let your will be done. In Jesus' name I pray.
Amen. Thank you so much for that wonderful prayer. And the next thing, we're gonna call on our brother to introduce our program, why we are here for. Hello. Welcome, Remark. Sorry, Honorable James X. Vanny. Can you please welcome our humble guest tonight?
Thank you, Mr. Crawford, for affording me the platform to do the welcome remark tonight.
Oh, wow.
I'm James X. Vanny, coordinator of Fujian Province, one of the host province. Good evening, good morning, good afternoon, wherever you find yourself around the globe. Welcome, everyone. I'm so happy you are here. Thanks to all of our organizers, our guest speakers, our veteran and sister, one of the survivor, who's going to be giving a testimony here tonight, and other scholars who have joined us tonight in honor of Breast Cancer Awareness Month. This October, we recognize breast cancer survivors, those struggling with the disease, and many family members and friends who support them. And we reaffirm our commitment to saving women's lives by raising awareness of breast cancer around the world. This program is dedicated to learning, supporting, sharing, empowering, and communicating with others in our community whose lives have been impacted by breast cancer. We hope that this program gives everyone the knowledge that is so very necessary to deal with this disease, and that it also empowers us with the strength needed to go through this journey. For and in behalf of Fujian Province, Jiangxi Province, and in collaboration with the Program and Planning Committee, PPC of LSUIC, I want to say you guys are wholeheartedly welcome to this program. Feel free, enjoy yourself, ask your question, and I hope that we all will learn from this breast cancer awareness tonight. Thank you so much.
Thank you so much, Honorable James X. Vanny, COC2 of Fujian Province. At this moment, I would like to call on our brother, Francis Dona, to give our introduction of our speaker. Hello.
Yes. Good evening. Good evening, ladies and gentlemen. I am Francis Donon from Lofa County, Liberia, West Africa. I'm currently in China and I'm studying financial management major. I'm in Fujian province, Samin City. I am the president of the city. Tonight, it is an opportunity given me to introduce to you our first guest speaker for this unique program. Our first guest speaker was born on March 26, 1983 in Kolahun, Lofa County, Liberia, West Africa. He grew up with his grandparents, Mr. and Mrs. Ngafwan Bala in Haber Firestone, Lower Mangibi County, where he had most of his childhood memories. He started his primary education with the fire school system in 1989 and completed middle school at the Simport Cadet School in Haber, Liberia in 2001. In 2001, he attended the Booker Washington Institute, BWI, in Kakata, Mangibi, and later moved onto the Moravia Free Pentecostal Mission High School in Cinco, Moravia, Liberia, where he graduated from high school as a veteran of his class in 2004. With excellent results in the West African Examination Council WAEC with Division 2, he was immediately enrolled at the University of Liberia in 2005 and graduated in 2010 from the T.J. Faulkner College of Science and Technology with honor with a Bachelor of Science degree, BSc in Zoology, minor in Chemistry. In 2011, he was awarded a bilateral scholarship after a thorough vetting process to study clinical medicine in China. He graduated from the prestigious Haber University Medical College in 2017, passed all requirements of the Liberian Medical and Dental Council for foreign medical graduates and was licensed as an MD to practice medicine in Liberia. From 2017 to 2019, he worked at the Redemption Hospital, John F. Kennedy JFK Medical Center, Jackson F. Doe Regional Referral Hospital in Tapeta, Nima County, James David Jr. JDJ Memorial Hospital in the Kingdom Care Medical Center in Liberia. In 2017, he also earned a Master of Arts degree in Intercultural Study, MAIS, from the Malaysia Baptist Theological Seminary. In 2019, he was awarded a scholarship from the World Federation of Neurosurgical Society, WFNS, Africa 100 China Neurosurgical Training Program for a 4 years, specially trained as a neurosurgical. Currently, he is a resident doctor in neurosurgery at the first affiliated hospital of the Jinnah University in Guangzhou, People's Republic, China. He is married and blessed with 2 boys and a princess. He is the visionary of the International Christian Medical Fellowship. Ladies and gentlemen, It is an honor given to me to introduce to you our first guest speaker for tonight's program. He is no one else but our own uncle, our father, our doctor, Dr. Augustine K. Bala. Ladies and gentlemen, I thank you.
Thank you so much. Thank you so much, our brother Francis Dona, President of Fujian Province. Honorable Dr. Bala, we welcome you on the platform tonight. Ladies and gentlemen, let us welcome Dr. Bala. Dr. Bala, are you there, sir?
Yeah, hello, can you hear me?
Yes, sir.
Okay, so we're going to do, thank you, Francis, for that. We are going to do, the next introduction is done and Dr. Super will be joining me. So we're going to do a panel discussion, not a separate presentation.
Okay. Okay, so while we wait Dr. Bala, Rudolph Double, can you please introduce our next guest speaker for tonight? Because it's gonna be a joint conversation, as Dr. Bala said.
Okay, can you hear me?
Yeah, welcome.
Okay,
You're right.
welcome. Good afternoon, everyone. I'm student Rudolph J. Double of Semi University, Fujian Province, Semi City. I'm so glad tonight to be one of the person to introduce our great doctors. Tonight, I will be introducing one of Liberia's great female doctor, and I'm so glad given this opportunity by the John provinces to introduce her. Our second guest speaker is a Liberian first female oncologist trainee at the Cancer Institute, Cairo University, Egypt. Our guest speaker spent her undergraduate days at Cottington University, where she studied biology, looking forward to medical school. In 2010, she was accepted at the A.M. Dougherty College of Medicine and graduated in 2016 as a MD. Our guest speaker was faced with many years of becoming a cardiologist. However, after the personal losses and seeing firsthand that Liberia doesn't have a trained oncologist, cancer doctor, she decided to refocus her attention. In 2009, after 8 years of battling breast cancer, her mother, 48, passed away a few months before she completed university. 3 years later, her aunt, who she moved in to live with after the death of her mother, also died of the disease locally called Goa, one which is really scientifically one of the many types of skin cancer. Even though she has been faced with many obstacles in life from 2009 to 2014, but somehow she found the strength to keep her head up, and when she feels hurt the most, she smiled and had her pain and keep the fight. Moving on. Few months after practicing as a doctor in Liberia, she was blessed with an opportunity to further her studies and do exactly what she dreamed of becoming, a medical oncologist. She is passionate about her work and work tirelessly in helping many survive cancer. Our guest speaker also has a personal blog where she regularly shares valuable information about cancer, basic cancer. Ladies and gentlemen, it's an honor to introduce our guest speaker. She's no one else but a role model, a teacher, a mother, the nation pride, Liberia's first female oncologist in person of Dr. Dede E.P. Supiwu. Dr. Dede, I want to say we are proud of you and you are highly welcome to this program. Thank you all.
Okay.
Good afternoon. Thank you for having me here. Can you see me? Can you hear me?
Yeah, we
Yes.
hear you loud and clear.
Okay. Thank you for having me here today. I'm very honored to be part of this program.
Okay. So thank you for all the introduction and thank you, Dr. Subu, for joining us. And
That
can
will,
you hear me?
from bigger trying to. Oh God, technology. Anyway, continue that I will just.
Okay. Yeah, so we're gonna actually have a panel discussion. We want to make it very interactive. So relax. We're not doing a scientific presentation. Okay, we're not going to I thought it wise that we shouldn't just allow Dr. Subo present, talk all the medical terminology for 20 minutes, and then also talk for 20 minutes. It just confuse you a lot. So we decided that we're gonna make it like a panel discussion. I'm gonna be asking some of the questions that will lead to the discussions, and Dr. Supo will then answer the questions. And after that, then we allow you ask questions, and then we move from there. So there are a lot, I believe, about breast cancer. We may not be able to say everything in the next 40 minutes, but definitely with the expertise of the medical oncology here, who is very passionate about this topic, I believe she will be able to answer many of those important questions and some of the important points, because I'm going to be asking the tough questions. Tough questions, not academic tough questions, but questions that frequently asked questions, let me put it that way. Yeah, so Dr. Superwood, are you set?
Yeah, let's get into it. We'll try to answer it as best as I can. So if I can make it, I will just just refer it back to
Yeah, so let's start. The whole thing, I know there have been a lot of things talking about breast cancer, breast cancer, breast cancer, breast cancer. So Dad, do you want to start telling us what is this whole breast cancer, breast cancer, breast cancer? What is breast cancer?
Okay, so before we go into discussing or defining what breast cancer is, first we need to understand what cancer is as a whole. Can you hear me?
Yes,
Yes.
right.
Okay, yes. So when we talk about cancer, we are simply talking about uncontrolled growth of cells occurring in the body. So if the cells are growing or particular cell is growing and then the body sends a message, I always like to make it simple by describing it as the body having a check and balance system, for the accountants online here and the management people to understand what I mean about check and balance system. Yeah, so it's about having a check and balance system, a control. So for the body to function properly, it's like it has a check and balance system in place that if it needs something, it will send out the instructions, like if it needs my hair to grow, it will say, send signals saying grow. And then when it reaches to the length that it wants it to stop, then it will send another signal and say it should stop. And so the hair is expected to stop. But when it comes to cancer, it's like the body is sending signals to this cell, telling the cell to stop growing, but the cell is not listening. So cancer simply refers to uncontrolled group of cells, despite the body sending signals saying that you should stop. And now the thing about cancer is that it can happen anywhere in the body. So wherever the cancer occurs is where it takes its name from. So for example, if you have cancer occurring in the large intestine, it's referred to as cancer of the colon, because we refer to as the large intestine as the colon, so it will be cancer of the colon. If you have cancer occurring in the cervix, which is the mouth of the womb of the female's womb, it's referred to as cervical cancer. So breast cancer now is simply these uncontrolled cells or this uncontrolled cell group occurring within the breast. So because it's occurring within the breast, that's why it's referred to as breast cancer. Excuse my coffee.
Okay.
Yeah, you can continue. Sorry.
Okay, so why would we decide to have awareness? I think there are many, like you said, you give the definition of cancer. There are many other cancers, right? So specifically trying to raise awareness for breast cancer, definitely that means there should be a reason. And I believe there is statistics that can be able to help us. So do you want to tell us what is the burden of breast cancer worldwide? And then specifically in Liberia, what is the burden of breast cancer?
Okay, so according to the WHO 2020 report on cancers occurring worldwide, which is the most recent, about 2.3 million new cases of cancers were reported. New cases as in people that were diagnosed in the year 2020. There were 2.3 million of them. Yeah, something like that. Oh, I'm getting the figures mixed. But yeah, there were a lot of cancer cases reported. Let me just refer to my slide. Yeah, it's 2.3 million. Oh, sorry. Anyway, there were a lot of cases reported. Let me just say there were a lot of cases reported because I'm getting the figures mixed right now. But there were a lot in all of the cancer cases I reported. There were about 9.3 million. So I'm mixing the figure up, but there were more cases, more than 23 million, about 23 million so cases. But then about 9.3 million cases of the new cases reported worldwide were breast cancer. So right now, worldwide, in both sexes, breast cancer is the most common cancer being diagnosed worldwide, both male and female. Now, when it comes to Liberia, we have been underreporting because we have not been, carrying out screening, we have not been recording cases, we have not really been treating cancers in Liberia. So according to the WHO 2020 report that we have on Liberia, we had about 3,500 plus new cancer cases reported in Liberia, which I believe is very much underreported. It's not. If we go back to the drawing board and actually start recording these cases, we'll find out that there were actually more than that. But according to the WHO report for what they have for Liberia now, about 3,500 cases were reported, and then out of the 3,500 cases, we have like about 500 plus cases being breast cancer cases alone, which was about 14% of the total percentage of cases reported. So this should, alert us to the burden of breast cancer. Worldwide, breast cancer is the most common cancer amongst females. But in Liberia, it's the second most common cancer amongst Liberian women. The first is cervical cancer, and then next to it is breast cancer. However, I believe that if we actually go back to the drawing board, you will be surprised that breast cancer just might be the most common cancer in Liberia. I was watching Dr. Sia Watakamano, the CMO for GFK. She appeared on the talk show hosted by Lone Star Cell MTN about 2 days ago, and the similar question was asked about the burden of cancer in Liberia, breast cancer, and she said before appearing on the show, she had visited the pathologist, and the pathologist is someone who diagnoses cancer. So she visited him just to get information on how many cases of breast cancer have been reported, have been diagnosed over time. And she said that he informed her that from 2019 up to 2022, they had diagnosed about 200 plus cases of breast cancer. And this is because we now have a pathologist in Liberia. So imagine, like a year from now, if we actually, when we actually decide to start doing a lot more, you will find that breast cancer just might be the most common cancer in Liberia, not the second commonest. So yeah, in short, breast cancer is the most common cancer amongst women, occurring women worldwide, which is why it is very important that we talk about it, because according to statistics, it's saying that 1 out of every 8 female will most likely develop cancer at certain point in her life. So you can understand the significance and the importance of us talking about breast cancer and creating more awareness that yes, there is something called breast cancer.
Okay, Dr. Supo, thank you for that details summary of statistic. And let me go back to the same question. I heard you. I like how you begin, right? Giving the simple definition first of all of cancer, and then before breast cancer. I know right now a lot of people will be like, well, this whole breast cancer thing is women issue. Well, you want to talk about that because I like the way you said, and it could probably be the most common cancer. Can men have breast cancer? Is breast cancer only a women issue?
No, it's not. Men too can develop breast cancer, but it is very rare. Male breast cancer cases accounts for 1% or less of the total number of cases that are being diagnosed. But however, men too can also develop breast cancer. So if a male has a family member who has been diagnosed with breast cancer, of mother, a sister, an aunt, there's a possibility that he too could develop it. Like in science, we can never say never. And we also have statistics to back this as well, because there have been cases of male breast cancer being reported. Like I've been in Egypt for the past 5 years, and I have seen at least 2 cases of male breast cancer. So that says that yes, of course, this can happen. So male too can develop breast cancer, even though the possibility is it's very small, but the possibility still exists. So yeah, so the thing is, it have a lot to do with genetics too. So maybe it's not very common on this side of the world. It could be because of the genetic makeup. Maybe it could be more common in Liberia because our genetic makeup is different, our environment is different, we are exposed to different environmental factors as compared to here. So there's a possibility that male can also develop breast cancer. So yeah, it's not just a female issue, it's also for men to know as well. But the reason why we stress more on women, because being a female puts you more at risk of developing breast cancer as compared to men.
Okay, let's take us straight to the next point, right? I think there are thousands of people watching us on YouTube, on Twitter, on Facebook, and people may have the discussion, well, that's women issue, right? That's breast cancer. You won't believe I was even talking to a female who said, that I don't even have breast. Why are you talking about breast cancer? And I told her, hey, stop that. You don't have breast because you think your breast small, so breast cancer not for you. And that's why we need this education. So that's good. What are the risk factors? What would make somebody be a higher risk of getting breast cancer? I think you just kind of started already. Women are more from a higher risk because you are a woman. But you want to go into details. What are the risk factors?
So there are so many things that can increase the risk of developing breast cancer. First thing we need to understand is that risk factors are things that increase the chances of you developing something. It does not mean that because it is there that you will develop it. It just simply means that it increases your chances of or the likelihood of you developing it. So with breast cancer, there are so many risk factors. The first we should know is old age, getting old. You cannot avoid getting old. You cannot force the aging process. It's inevitable. So getting old, yeah, it's the number one risk factor for breast cancer. The next one is being a female. So whether you like it or not, the fact that you're a female, you are automatically at risk of developing breast cancer. It has nothing to do with whether you have big breasts or small breasts. The fact that you're a female, it puts you at risk of developing breast cancer. And then there's the issue of hereditary, cancer syndromes. Like having family members that have been diagnosed with breast cancer before, like your mother, your sister, your aunt. So if you have a family history of breast cancer, your risk of developing breast cancer is higher than the general population who is not at risk, who does not have any family history. Then you as an individual, if you have been diagnosed with breast cancer before, the risk of you developing it again is higher compared to someone who has never had breast cancer before. And then there's the issue of lifestyle. So if you are not living an active life, if you just what we refer to as a sedentary lifestyle, where you don't move around, you don't exercise frequently. Not exercising, it also puts you at risk of developing breast cancer. Not watching your weight, being obese, like just in Liberia and in Africa, we say the bigger the woman is, more beat. Yeah, more beat, more, but yeah, but the truth is not watching your weight, being obese, being overweight is also a risk factor for breast cancer too, because cancer feeds on fat. So being obese is a risk factor for breast cancer. Another one is alcohol. Drinking alcohol is likely the chances of it increases. It might not increase it directly, but it also increases the risk of breast cancer. And then there's the other part that also puts you at risk of cancer, breast cancer, is the how do I put it? It has to do with the female, your female reproduction or your female reproductive system. So if you have someone who saw your menses very early, before the age of 12, or if it puts you at risk of breast cancer. For those who have late menopause, like beyond the age of 55 years, that's another risk factor. If you have never gotten pregnant before, what we refer to as nulliparity, that's another risk factor. If you decided to have your first full-term pregnancy, or if you had your first full-term pregnancy after the age of 30 years, so yeah, like you like me, you pursuing career, you're not ready to have a child yet. Yeah, I'm not sending people out there to go and start boning, but I'm just telling you that is a risk factor. That yeah, that if you had your first full-term pregnancy, as in the first pregnancy that you carried to term and gave birth, if that happened when you were beyond the age of 30 years, that is another risk factor for breast cancer as well. And then last but not the least, another risk factor for breast cancer is previous radiation. So if you had cancer, somewhere in your chest, or maybe you had lung cancer or something, for some reason you had to receive radiation, which is another form of cancer treatment, and it was directed towards your chest. And of course, we know the breasts are located in the chest, right? On the chest wall. So yeah, so previous radiation exposure is also a risk factor for breast cancer. So you see, there are so many things that can put you at risk of developing breast cancer.
Thank you, that. And I like you said there are so many, and I also like the cautions you gave, because we have a lot of viewers who are not medical professional. We also want to be very careful as we try to be as simple as possible. We want to be very careful to not scare you, and to not also make you get the information in the wrong way. like Dr. Superwood said, risk factor doesn't mean that you're going to have the disease. You can have the risk factors and you may not have breast cancer, right? So don't start getting worried. Oh, my mom had a breast cancer, so it means I'm going to have a breast cancer. That's not what risk factor means. But I think it cautions you, like Dr. Superwood
It
said,
puts you on
so that you
guard,
can
yeah,
start
just to
watching,
be
right?
careful. Exactly.
So, and one of the factors is that I think a simple way I usually put risk factors as a surgeon, I tell my patients, well, if you get in the plane to travel, there's a risk that the plane will crash and you die. But that doesn't mean you can't get on the plane.
Yep. Exactly.
Yeah, so you get on the plane, you travel as many times as possible, nothing happens. But yes, every time you get on the plane, even on the car, there is a risk that you could have an accident and you could die. So that's risk factor. But Dr. Superwood, I believe some of those risk factors, we can do something about them. Some of them, we can't do anything about them. I've heard you use the word modifiable, not modifiable. Do you want to say something about that? What are the ones that we can do something about?
Yeah, so the modifiable ones are the ones that you can adjust your lifestyle and reduce your risk. The non-modifiable ones are the ones that you can't do anything about. So let's talk about those ones first. Number one, like I said, you cannot avoid getting old. You cannot stop the aging process. You cannot say, okay, I'm going to force my aging process. I'm not going to go beyond the age of 35. I'm not going to go beyond the age of 40. I'm going to be 50 years for the rest of my life. It's not possible. So you cannot avoid
Even if every year your birthday is the same, even if every
yeah,
year you say you 18, it
yeah,
does change your
that's
state.
exactly. You cannot just even if having suffering from Benjamin Button disease, you can't avoid that. you are still getting old. So you cannot avoid getting old. So of course that increases the risk. As a female, being a female, you cannot change that fact, right? You cannot change the fact that you're a female. Um, even though the world we live in now, there are so many things going on, but you cannot change your genetic makeup as a female. So that is something that you cannot do anything about. The next thing is you cannot alter your family history. The fact that someone in your family had breast cancer before, you cannot go and stop and say, hey, you don't have breast cancer, or like do not have breast cancer anymore. You cannot stop that family history. So there's nothing you can do about that. And then the personal history, if you have breast cancer before, you cannot change the fact that you developed breast cancer before. So the chances of you developing it is higher compared to someone who has never had cancer. You cannot do anything about that. Then there's the issue of having your menses early and then the late menopause. So those are things that you cannot do anything about. On the other hand, when it comes to things that you can adjust, you can work on, like for example, watching your weight, eating healthy, making sure that your weight is within the normal range. So for the non-medical people here, you can just after the program or as the discussion will, you can just Google body mass index. It will and just read on it because there's a range that you're supposed to be within to be considered, having a normal body weight. So you can just make sure that your weight is within this range to have a healthy weight. Exercise regularly, watch what you eat, and alcohol. Avoid alcohol if you can. If you can't, watch the amount of alcohol that you take in because with the issue of alcohol, it's not just breast cancer that you will be increasing your risk for. There are so many other cancers that alcohol exposes you to. So it's not just breast cancer. So yeah, you can adjust the lifestyle. You can exercise more often. You can watch your weight, eat healthy diet, avoid alcohol. Yeah, but then when it comes to the family history, you can't do anything about it. And if you have been exposed to radiation before, you cannot change the fact that you have been exposed to radiation. So whatever goes on after that process, you don't have any control over it. So the modifiable ones have more to do with adjusting your lifestyle. That's where we have control over. And that's what we have control over. The rest of them, the other ones, you don't have control over them. So yeah, basically that's it.
Okay, before I go to the next question, I we want to welcome those that are watching from Facebook, YouTube. You can actually send a question and comment. We can be able to read it live here because we are streaming from Restream. So I see Patrick Myers saying, boss lady, I don't know whether he referring to Dr. Yeah, welcome, Patrick. Good to have you following us, and many of you watching from Facebook, from YouTube. You can send in your question while the discussion is going on. We'll definitely be able to read those questions. I'm seeing them from here. We'll be able to read those questions and address them if we can. So I want to welcome all of you watching from YouTube, Facebook, Twitter. Thank you for joining us. So, Dr. Supo, what are some of the signs and symptoms? Again, I believe it's not to scare people, right? But it's good you know, so that if you have these things happening to you, you can watch and like, okay, let me know what it is.
Okay,
What
yes.
are the signs and symptoms of breast cancer?
So the most common sign and symptom of breast cancer is having a lump in your breast, or what we refer to as a knot in Liberia. So the most common. Okay, first let me throw it out there that sometimes breast cancer might not have any signs and symptoms from the initial stage. Sometimes because cancer is a silent killer. Normally, cancer from the beginning is usually asymptomatic. That means from the early stages of cancer, there will be no symptoms. But then as the disease progresses, then that's when symptoms begin to develop. So sometimes you might not have any symptoms. But then the most common ones include having a lump in your breast, or knots, or mass. Sometimes the lump might not be in your breast. Sometimes, okay, we will get to that question, Catherine. Sometimes the lump might not be in your breast. Sometimes the first place you might discover the lump will be underneath your arm. And that's because the first place I always like to talk with, the first place that cancer spreads is underneath the arm. My mother, when she was diagnosed with breast cancer, the first place she noticed the lump was underneath her arm. There was no mass, there was no lump in her breast. So the lump would be either in your breast or it would be underneath your arm. Another thing is breast pain. You're experiencing pain in your breast. That could be another symptom of breast cancer. Another one is looking at the nipples of your breast. The nipples supposed to be outside, but if you notice that your nipples are like drawn in, like something is pulling it from within and is going inside, we refer to it as nipple retraction. That's another presentation of breast cancer. Sometimes the nipple might even appear scaly. So you look at the nipple, see if it appears scaly, see if it's been pulled in. That's another symptom of breast cancer and sign. Another sign or symptom of breast cancer is looking at the skin of your breast. Sometimes the breast might not have any lump in it, but if you look at the skin, the overlying skin of your breast, it might look inflamed. In someone that is fair skin or fair in complexion or light in complexion like me, or even lighter than me, the skin might appear red. It might appear red. If picture an orange peeling, the way orange peeling looks, with small hole inside what we call dimple. So there's some in France we call it, I hope I pronounce it right, port du ranch. So that means skin of it appears edematous, it appears reddened, it appears swollen with the holes inside. So that's another risk factor. That's another symptom of breast cancer. In someone that is dark in complexion, because I know people will be like, yeah, so how about we who are dark in complexion? It's not just about light. If I'm dark, if you are dark in complexion, the skin might appear darker than the rest of the other skin, and you still might see the small hole dimples in it as well. So those are the most common clinical presentations of breast cancer. So again, it's either a lump in the breast. Sometimes another thing is the size of your breast changes in the size of your breast. So I know that naturally the female breast, one is usually bigger than the other, is not always the same size. By nature, one will be slightly bigger than the other. Yeah, but then if you notice there's significant change in the size, like one looks abnormally bigger than the other one, it looks swollen, the skin looks red or it looks darker, that should be alert, or something to catch your attention. And another thing, nipple discharge. So if you are not a breastfeeding mother, you are not supposed to be having nipple discharges. So if you notice your nipple discharging any fluid and you are not breastfeeding, that should be something that should alert your attention. Most times the nipple discharges associated with breast cancer will be bloody, but that does not mean that you can have a milky nipple discharge as well. But the fact remains that if you are not a breastfeeding mother, you are not supposed to be having any nipple discharges. So if you have nipple discharges, if you notice any change in the skin of your breast, if you feel your breast and you feel a lump in your breast, if you feel a lump underneath your arm, if you see your nipples being pulled in, or the nipples, the area around the nipples looking scaly, if you see the breast, like there's significant changes in the size of the breast, those should all alert you that something is wrong, and then please try to seek from your doctor's advice for further assessment. Because sometimes the lump might be there, all these things might be, sometimes the lump might be, it might not be cancerous. Yeah. But still, if you're experiencing any of these, the next step is to go visit your doctor.
Thank you, that's super. It's kind of difficult to be a doctor in our kind of environment, right? People ask you about everything. I'm doing residency in neurosurgery, but my cycle of friends, people who know me, you have these two group of people, right? One group were like, we were, I've been knowing you from childhood. I'm not going to ask you about anything. But they still ask you, you tell them what it is, they won't listen.
Yeah.
And you have one group of people who give you so much because you're a doctor.
Yes.
Yes, they expect you to know everything, right? So I'm a neurosurgeon. They ask me orthopedic issues. They ask me, gynecology issue. They ask me like everything. So I have to continuously review my ability as a general practitioner. People being
right. I have a trick for that actually. What I usually do is I will try to answer. I will try to not answer because I would think that I would try not to hang myself. So I would just tell you like, yeah, in medicine, anything is possible, never say never. However, that is not my favorite or specialty. So I would, I can refer you to someone that can explain to you further. That way I'm saving myself and I'm saving you because I don't want to send out the wrong information to you. And then I don't want for you to go find out the right information at the end of the day and come and say that don't lie to me. So yeah, it's and knowing your limitation as an individual too. Yeah, so it's always good to play safe. If I'm not comfortable with the topic, I'll be like, I'm focusing on cancer right now, so I can refer you to someone to answer your question for you. So yeah, but like you said,
yes.
it's get asked these questions all the time.
Exactly. And again, to let me make the clarification, when they were doing the flyer, I was back and forth telling them, hey, I'm a neurosurgeon resident. So, I'm
Me
now a
too. Remember
neurologist.
our conversation.
And Dr. Super is a medical oncology. And so I think that's the point we're coming from, emphasizing our area of specialty. And I could talk about breast cancer, but I'm more comfortable having Dr. Super to answer these questions the way she's doing it. And I'll easily transfer it kind of just refer all the questions to Dr. Super.
Yeah, right.
Because that's her area, right? Even though that we know we're going to the end gradually of our discussion to start questioning, even though we know that breast cancer, like you said, could spread, it could have breast cancer metastasis to the brain. I've got a lot of brain metastasis patient that was due to breast cancer. But is breast cancer treatable? Is it treatable? And if it is sure that, well, even if I have breast cancer, there's a way out. What are if it is treatable, what are the available treatment method or treatment options?
So, breast cancer is treatable, yes. especially if it's at the early stage. Now, I'm being very careful with my choice of words because there's a difference between me saying it's treatable and curable. So if I tell you that something can be cured, that means the person can receive treatment and the disease will go away for good and it will never come back. However, if I tell you that it's treatable, that means I can treat this patient. There's a possibility that it will go away. There's also a possibility that it will not go away, but it will not progress. It will remain as it is for a while. There's a possibility also that I will treat this cancer, it will go away, and it will come back after a while. Because like I said from the beginning, that having breast cancer as an individual is a risk factor for breast cancer. So if you had it before, there's a chance that it can come back, right? So yes, breast cancer is treatable. The best time is, like when it's early. So breast cancer and every other cancer are clinically staged into 4 stages. So in summary, because when we staging breast cancer, you have to look at the physical examination findings. That means you present that to the doctor, he or she examine you, what the formal physical examination, and then the other series of tests, because we want to know how far the cancer has spread. So based on your lab results and your physical examination finding, breast cancer and every other cancer can be staged into 4 stages from 1 to 4. So in short, a stage 1 breast cancer is a breast cancer where the cancer is only in the breast. That is it. It's in the breast. It has not spread to the lymph node, or the arms, or anywhere else. So stage 1 is the breast cancer is in the breast only. Stage 2, the cancer has spread from the breast to the lymph nodes. So the lymph nodes, it could be in the arm. Stage 3, the cancer has spread beyond the lymph nodes of the arm. It could even spread the lymph node up here to your collarbone, or it could involve other lymph nodes within your chest wall that you cannot see from outside, that the image in the CT scan will be the one to tell you. Or it could involve the skin, the outward skin of the breast, wherein the skin is involved or is attached, or the breast has become attached to the muscles, the chest muscles. So if the doctor is used at that point, the breast feels like is fixed, is not like mobile and stuff like that. Stage 4 is where the cancer spreads beyond the breast. It could have spread, but it could spread to the lungs, it could spread to the bone, it could spread to the liver, it could spread to the brain, or it could also spread to the other breast. So because if it spreads to the other breast, then it's metastatic. So depending on the stage of the disease that you are diagnosed at, is how your treatment is tailored, because with cancer now it's more of a patient tailored management. We try not to use one size fits all for every patient now. So we try to treat, there are guidelines, but individually there will be certain differences that will require you as a treating physician to tweak your management. Now, there are 3 broad categories for the management of breast cancer. Let me do the surgery first. So the first one is the surgery, wherein you can either remove, if the breast cancer is early, you can remove just the lump and some healthy tissues around to make sure that you remove the entire, cancer, the entire mass. And then the surgeons usually do whatever they do to check the lymph. They remove some of the lymph nodes of the arm as well, underneath the arm as well, to assess it. That one is for the surgeon. So if it's early, you can either just remove the lump and save the breast, and that will refer to it, generally speaking, as the breast conservative surgery. That means you're not removing the entire breast. On the other hand, if the breast is the cancer is more advanced, so you can then you have to remove the entire breast. So whether you removing the entire breast along with the chest muscles, or you leaving the muscles and just removing the entire breast, that one is up to the surgeon. But generally speaking, surgery is one of the ways you can treat breast cancer. So you can either remove the lump, or you save the breast, or you remove the entire breast. So that's for surgery. And then there's radiation. So radiation is where the patient will be exposed to radiation. there's a machine. The radiation oncologist before that you have to go and plan, you have to do all the physics and different complicated things, and because they have to direct the radiation to the cancerous area to make sure that it's going to the cancerous cells and not the normal tissues. So radiation is another way of treating treating breast cancer. They will plan you, you will go, they will lay you down and do the drawing, and I'm sorry that I'm switching to a little bit of global. Yeah. So yeah, they will plan you, and then after everything, then they will put you in a machine, and then they will direct the radiation beam to you. So it's surgery, and then there's radiation, right? And then there's the medical aspect where I come in. Where now it's yeah, that's where I come in to treat medically. So for the medical management of breast cancer and any type of cancer, but for breast cancer, we can treat with chemotherapy. So these are drugs. So the drugs can be medical management for breast cancer. We can be either using just the broad spectrum drugs for cancer to treat the breast cancer, or you can treat hormone therapy using hormone therapy. And then something I forgot to mention in the risk factor, another risk factor for breast cancer is taking oral contraceptive pills, family planning. Family planning is a very common risk factor for breast cancer. I'm sorry I didn't mention it, it slipped my mind, but it is a very common risk factor for breast cancer as well. So yeah, in as much as we, try to prevent pregnancy, unwanted pregnancy, you have the kids nowadays, getting involved in sexual activities early, so parents tend to take them and put them on family planning. Why it is good that you are trying to prevent unwanted pregnancy and teenage pregnancy, but keep in the back of your mind that you're also exposing this child to the likelihood of developing breast cancer in the future. Yeah, so coming back now, sorry that I have to be switching in between. If you get confused at any point in time, just ask question and I will try to explain. So yeah, medically you can use the broad spectrum, let me put it that way, drugs to treat cancer, which we refer to as the chemotherapy. Then we can use the hormone therapies to treat the specific type of breast cancer. And then we have what we call targeted therapies, those ones because sometimes the cancer cells will express certain proteins and certain receptors, or let's just say have a gate man on the cells, on the cells, that there are drugs that can directly go and fight that gate man and block him or block her, and then blocking this gate man will start to spread the cancerous growth. So we refer to that as targeted therapy. Then there's also another class of drugs that we use that we refer to as the immunotherapy. These drugs are the ones that are given, they are given to help your immune system, because your immune system is your defense system. By your own now, that's the defense ministry for the body immune system. So, and the cancer weakens the immune system. So the immunotherapy now helps the defense system to strengthen it. It's like we're having wow, how many is it? AFL.
AFL?
Yeah. So it's like yeah, it's like having, it's like having, like an internal crisis ongoing, and AFL goes there to fight, help to continue the situation. But the AFL is not enough. So we decided, okay, since AFL not enough, that's saying like broad national police, that's saying immigration, to help boost AFL. So that's how the immunotherapy works. It helps to boost the immune system. So after all my plenty talking, there are three major ways that you can treat breast cancer. You can treat breast cancer with surgery, you can treat breast cancer with radiation, and you can treat breast cancer with drugs. So depending on the stage is how you will treat, because most times it's not just one way. Sometimes you will use surgery and medical. Sometimes you will use all of them, all three of them. So depending on the stage of presentation is how the treatment plan will be tailored for the management of patients living with breast cancer.
Okay, that was long and details. Thank you so much. So we we're to start taking questions at 9 o'clock. So what I'm going to do is that I already see a couple of questions in the chat. And so I'm going to take these 3 questions that I have in the chat. And if there is any also coming from Facebook or YouTube, we take that. And then we allow the master of ceremony to coordinate. If you have people that are live here that want to ask questions, they will be able to coordinate that, raise their hands and talk. But I have a couple of questions in the chat. Dr. Super would like to these ones, I think about 2 or 3, before we turn over this. So you answered one of the questions already, the stages, and I think you explained that in details in connection to the treatment. So another one is breast cancer curable in the third stage? This is a question just coming in.
Before I answer that, there was a question that was asked earlier if bra, the type of bra you use can give you.
Oh yeah, I think that's the first question. Let's go from up.
Yes,
Sorry.
I saw that. To answer that.
Okay, can a lady get breast cancer from the bra she wears? Example, sponge bra or bra with iron in it. Yeah, that's the first.
Science has not proven that. And I like to keep my answers based on scientific findings. So science has not proven that the type of bra you wear puts you at risk of developing breast cancer. Maybe you came across a research that says that. So if you have, please, you can please share with me later. I would appreciate it. But science has not proven that the bra you use puts you at risk of breast cancer. The next question about if breast cancer in
besides, I think that's going on. I want to say, besides alcohol, is there any lifestyle habit that can put one at risk of breast cancer? Did you see that?
Yes. Okay. Yeah. So also another risk factor for breast cancer that has to do with lifestyle also is smoking. Smoking has some risk. There's certain level of risk. So modifying the lifestyle besides alcohol, stop smoking, exercising regularly, watching your weight, being very careful with the kind of food you eat, even having a healthy diet. Those are ways in which you can modify your lifestyle to reduce the risk of developing breast cancer. So it's not just about not drinking alcohol.
And then that was followed by there are how many stages of breast cancer, and I think you answered that in the discussion talking about treatment. Yeah. So the next one there is for surgery, what are the chances for survival? What's the survival rate?
So like I said, in most cases, breast cancer management is not just with one method. So most times it's usually with surgery and medical, or with surgery and radiation, or with medical and radiation. So surgery, you can use surgery. When you can use surgery alone is when the breast cancer is very early. That means you have a stage 1 breast cancer, and it's the breast lump is just within the breast. The lump is small, so it's using the tumor size, because when we staging breast cancer, we use something we refer to as the TNM staging, wherein the T stands for the size of the tumor, the N stands for the lymph nodes, and then the M talks about metastasis. That means whether the cancer has spread or not. So with the T staging, the size of the tumor should be 2 centimeters or less, and then T2 is wherein it's between 2 to 5 centimeters. T3 is if it's greater than 5 centimeters. T4 is if it might be any size may evolve the skin of the breast, or if blah blah blah. So surgery alone, you could use surgery and I'm saying could because I'm trying to be very careful with the message I say now. So you could do surgery alone if you have a T1 tumor. That means the tumor is less than 2 centimeters or 2 centimeters or less. That means it's just the tumor, that small lump in the breast, and there's nothing else, no other involvement. In that case, you could remove the tumor alone, and Yeah, it's not that it will be cured, and there's not it's a possibility that you can remove it and after a while it will come back. So, but with the survival of surgery alone, with the early stage, the 5-year survival is like up to 75 to 80%. But then let us understand that let us understand something that the higher the stage, the lower your survival rate. In broad terms, that's just it. So if a person presents with breast cancer that is stage 1, the chances of them being alive 5 years later is higher compared to someone that is presenting with stage 2, and someone that or stage 3 or stage 4. Someone that presents with stage 2 cancer, the chances of them being alive at 3 years or 5 years is definitely higher than someone that's presenting with stage 3 and 4. So the more advanced the disease, the lesser your chances of survival. So that is just broad in broad terms, that is just it. Yeah. So
Okay.
surgery alone for early stage 1 breast cancer, because that is where there's a possibility of you doing only surgery.
Okay.
But then again, there are so many other things involved. So if at all you did only surgery alone for stage 1 breast cancer, the possibility of you being alive at 3 years, at 5 years is about 75 to 80%. Yeah. But you should also bear in mind that there's a possibility that this cancer will come back.
Yes, sure. And that is followed by at what stage of breast cancer is breast cancer curable in the third stage, and at what stage of breast cancer the breast is removed? And I think Dr. Spo were talking about surgery, but also I'm not sure we may go into detail into that. But there are different type of surgery. You could have partial mastectomy, you could have where you just remove part of the breast, and it could be a point where they could remove the entire breast. So I don't know, you want to say something about that, even though you're a medical oncologist, but yeah, you are a general practitioner before, so say something.
Like I said before, I will try to answer the best of my abilities. And where I found that I will be teaching, don't be surprised or don't say, oh, she's not doing it. If I refer you to the surgeon, because I'll be like, for more information, you can refer to the surgeon. But the question about whether breast cancer is curable in the third stage. Like I said, I try to avoid the word curable, because when you cure something, that means it disappears completely and it will not come out again. Let me put it in Polokwa. When you say
yeah, plenty Liberian here, we can understand that.
Yeah, treat the person, all the cancer disappear and it will never come back again. So there's a difference. So there's a difference between curing and treating. So I don't want to use the word cure. However, there's a possibility that you can treat someone with stage 3 breast cancer. And stage 3, that means, cancer has not spread to distant organs like the brain, the liver, the lungs, sometimes even the kidneys, or the bones, so it's involving the skin of the breast, or it's attached to the muscle of the chest. So, but it has also not spread to the other breast. So if it's just, in the breast and the lymph nodes, and there's no distant spread, there is a possibility of being treated to the point of the cancer disappearing. However, let me make something clear, because in cancer management, because when you're treating cancer patients, you assess their response along the way. So there are different levels of responses. You have the complete response, wherein you have treated this person, and over time you have assessed them, and at the end of the treatment, you found out that there's no more cancerous cells. The cancer cells have disappeared completely. However, there's a possibility that this cancer will come back, especially if it's more advanced. So sometimes you will treat someone and this person, all the cancer cells will disappear. That does not mean the person is cured. That does not mean the person is cured, especially in advanced stage. That does not mean this person is cured. That means the person had a complete response. That means the person responded to treatment. But there's a possibility that this cancer can come out within the next 1 year, within the next 2 years, within the next 6 months, within the next 5 years or 10 years. The possibility exists that it will come back. So with cancer, especially more advanced stages, we don't like to use the word cure because anytime it can come back. So I wouldn't want to say stage 3 breast cancer can be cured. However, I will tell you that stage 3 breast cancer can be treated, and there's a possibility that this person might respond completely, have a good response to treatment. Because at that point, so stage 3 breast cancer, treatment usually involves medical management. It usually involves surgery and radiation. So if you're in an ideal setting where you were able to have access to all 3 forms of management, and your physician, treated you and you responded well to treatment and all the cancer cells disappear, it does not mean you are cured. It means you had a complete response. And even with patients like that, we don't leave them. We don't leave them and say, okay, you have received treatment, the cancer cells have disappeared, so you can go home for who? No. Even if all the cancers disappear, we still follow it up. So if we had a complete response, I think all the cancers disappear, the first 1 year after the end of your treatment, every 3 to 6 months, you will have to go back to your doctor. Every 3 to 6 months for the first 1 or 2 years. After that, you will go back every 6 months. So we will usually follow you up for 5 years or beyond. So it's not because that is because we are following so that whenever it comes back, we can be able to catch it early and treat it. So stage 3 breast cancer is not curable. I don't want to use the word curable. It can be treated, and there's a possibility, and that one has to do with more with genetic makeup. So I cannot determine who will have a complete response to treatment and who will not have a complete response because there are so many things involved. It has to do with the aggressiveness or the cancer, how aggressive the cancer is. It has to do with the type of cancer. It has to do with the rate of dividing, how rapidly the cancer cells are dividing. So there are a lot of things involved in the cancer. So I would not want to tell you that stage 3 breast cancer can be cured. So close, because me a little make my message clear in the end. Because that was who name going on. I would not want to tell you breast cancer as stage 3 can be cured. I will, however, tell you it can be treated, and there's a possibility that the cancer cells might disappear. There's a possibility, but it's not everyone who will receive complete response. Some people have
that message have been hammered. That message have been hammered. That message have been hammered.
Yeah, I left for it to be clear. Let me be clear on the issue.
Yeah. So I think that was very important to understand the word curable and treatable. Okay, but before we turn over to our moderator, let's take this last one. It's gonna be I think this question is gonna help give your take-home message, and I'll turn over to the master of ceremony, and maybe if there is question within the from people on the platform, then maybe we do that. But I think we have discussed a lot. We can say everything and finish about breast cancer. I can tell you that the super who has spent 4 years already. She finished studying her entire life practicing. She'll be studying. She'll be studying. Speaking of Kolokwa, she'll be studying. Still, she'll not finish learning everything. So definitely will not be able to say. We'll not be able to say everything and finish today, but Dr. Supo, there's a specific question here. You can tie that in a few minutes to your take-home message. How can we promote and strengthen breast cancer awareness in Liberia? There's a question from Catherine. Nothing that tie into your take-home message for a few minutes.
Okay, yes. So, the awareness starts from, as we know, education. There's not a lot known about cancer in Liberia. To our mothers and our sisters out in the rural areas, they have these things going on with them, and the thing that is Goa. So the first thing is we need to send out the message in whatever way we can. I believe if we need to promote the messages in various dialects. Like I'm from Lofa County, but I don't speak Roma. Sorry, unfortunately. So if if I'm going to LOFA to go and create breast cancer, we need to actually reach out to people in the community, and make the message in a way that people will understand. You can't expect me to move from Monrovia to go LOFA County to explain to my grandmothers and great-great-grandmothers about breast cancer, and then I'll be speaking hell about BB book. It would be a waste of my time, it would be a waste of the time. So, I believe, the way we should convey the message, we can create these jingles on breast cancer aware, because breast cancer doesn't happen only in October. Breast cancer, because it's in October that you hear the whole country talking about breast cancer. Oh, it's breast cancer awareness month. But it's not only in October that people are diagnosed with breast cancer. People are diagnosed with breast cancer every day. So we need to create the message and send it out every day. Create jingles on the radio, and share on the radio, put it in the various dialects if we can, and tell these people that when you experience this not in your breast, or you see your tete more going inside, go see your doctor. Or if you see blood coming from your tete more, I mean, it's funny, but for me,
No, I like the way you're
see,
saying it. You're talking more.
yeah, because one thing is you need to be strategic. You need to be strategic. You need to speak at the level of your listeners.
Yes.
Yeah, I could, if it was just on this conversation, I could be using all my medical things, and I know you follow, but because I know there are people who are non-medical, so I have to make it as simple as possible. But yeah, we need to go out, and then another thing we need to do is, another way is, carry on screening programs, encourage people to do mammograms. Encourage people to do mammograms. Encourage people to, you can, in fact, the screening starts with you as an individual, as females, every month. After you see your period, when it finish, give it at least a week later, check your breast, do your self-breast examination. And it's very easy to do. You can just stand in front of the mirror, look at your breast, look for anything that looks abnormal, look at the size of your breast. Do they look the same? Look like the skin of the breast, do they look the same? Do you notice anything abnormal about your nipples? Just look at the breast, look at your breast. After that, you can either lay on your back and use the inside of your hand right here, and just feel around in your breast. You can either go in a circular motion movement from out to in, or you can go up and down. Just feel your breast. When you're done, feel underneath your arm, because like I said, one of the first places that breast cancer can spread is underneath the arm, right? So feel underneath the arm. So you can do that laying down, or you can remain standing in front of the mirror with your hand above your head like this. If you're checking your left breast, you put your left hand above your head and use the right hand to check and feel your breast. When you're done, lift up your hands, and just look at your breast. Turn on the side and just look, because sometimes if you have a lump underneath the breast, if you don't lift up your hand, you might not notice it. That is if you're not laying down. So just do self-breast examination every month, ladies. That is how it begins. After that, if you have access and if you can afford it, from the age of 50 years, it's advisable that we 50 years and above do the mammogram every year, and the mammogram is accurate of the breast. If you have a family history like me, here you can start even earlier. Yeah, you can start even earlier. If you don't have a family history in your 40s, you can discuss with your doctor if you should start breast screening or not. It's not a problem, but just discuss it. But then it's about sending out the message, educating people that there's something called breast cancer. And if you see that breast looking, because most times, let's be frank, most times the cases that we come across in Liberia, they are very advanced. I've seen breast cases where, sometimes I would be, here my colleagues will send a picture to me. What can we do? The entire skin of the breast is, now when you see it, they even got to tell you, say the one at breast cancer, you already know what's up. So, and those things don't happen overnight. It's a gradual process. Sometimes the patient will tell you they have been experiencing this for 2-3 years. So tell me, if this person knew all along that, they should check their breast every month, and if they find anything that they're not happy with, they should go see the doctor. We won't be having a lot of these advanced cases, but because of lack of knowledge. The Bible says, when people perish because of lack of knowledge. So we need to improve our message. Yes. So we need to encourage, we need to take out the message and not just wait for only for October. So we walk for breast cancer in October. Everybody here, oh, Dr. Supu, can you please come on another talk show? Or everybody, hosting talk show talking about breast cancer. October finish, then what? Then we go.
And that's
So the breast
October.
cancer will be waiting for October before it happens. No, it wouldn't. So so
We
we
need
need
more
to
of
talk.
that.
Yes, it's now in October that people develop breast cancer. So we need to go beyond October. So yeah, that's it.
Thank you so much. We need to go beyond October and talk about every day, and it's everybody's business, right? Don't just somebody I see amazing. We can volunteer. Yes, volunteer. Remind her, because you have access to it as well. Help her. Check it. Let's go beyond October. Let's volunteer for our wives. And remind your sister. You can check your sister on. You can remind your sister, but even your wife on. You can check it. Tell her, hey, sweetheart, let's see. Let's make sure. Put your hands up, right? And yes, that means that your wife. Yeah, we got one. Thank God we get the married man, the MC today. So, Mr. Cluffer, thank
Yeah,
you.
you can help
Over to
your
you.
wife.
We'll make sure you help your wife and check the breast very well. It's for you now. Nobody will hold you responsible. Nobody will tell you to go. Thank you
It's an
so
everyday
much,
process,
Dr. Subaru. And now we turn over to the master of ceremony. I don't know if you have to keep us for the next couple of minutes and you tell us so that we can retire. And Dr. Subaru is a very busy person. I'm talking for her, not talking for myself. So maybe we can give you a couple of minutes and see what we can talk about. Then maybe we'll run away from you.
Okay, thank you so much, Dr. Superwood and Dr. Bala, for this wonderful conversation we just had. I would like to take a few questions from the audience, but we will postpone it because of time. At this moment, I would like to take a few statements from our survivor for about 15 minutes. So I don't know if you guys can wait just for a few minutes and then we can give the audience chance to ask questions, because I know this conversation is so interesting. We don't want to let it go tonight. Like for me, I was so surprised when I heard that women can also have breast cancer, So I also want to learn more tonight, but due to time, I'll call on Miss Catherine and Weah, our survivor, to give us few statements of how it was like for her and her experience, so on. So Catherine, you're welcome.
Good afternoon from my end. Is everybody hearing me?
Yeah, we are hearing you.
Yes, we can hear you, kids.
So
And good to
the
have
first
you.
thing I would say, the first thing I would say is that when you hear Lone Star Mini, Orange Mini, recharge your phone, you might just know that it's beer. And I'm sitting under the tree. Okay, I want to say thank you for the invite. Dr. Bala, I've been here since 12 and you did not recognize my presence, so I will summon you.
I'm sorry. I'm so sorry. I'm very, very sorry. I'm guilty.
Good. Thank you so much, Dr. Smo. I've learned some things that I've experienced. I heard some things that I've experienced, and I learned some things that I didn't know that was possible. So the teaching was good, and we bless God. So those that don't know me, my name is Kate Weah. I am a survivor of stage 3 breast cancer. I went through 9 cycles of chemotherapy and went through radiation. And today I'm alive thanks to the student community in China, both Liberia and Africa and across the world. I'm very grateful to you guys for all that you do, stood by me, and I'm alive today. Even though I'm still in a medical process, as Dr. Suvo said, I'm still doing treatment, I'm on medication. I go for CT every 3 months.
but I'm still keeping the hope alive. Like you see on my hand here, I wear this every day. It says, never lose hope, because I read a lot about the breast cancer, and I know sometimes I feel like I'm on a time bomb, but then I know that I have God. And so that time bomb might not explode anytime soon. So for my experience, the histology, I don't know how you doctors call it, proved that I contacted the cancer from my father's gene. And then when I called my father, he said one of his aunties died from it. And this have been over years, I've lived with it. I got diagnosed at the age of 37. And so it been in my body all the years. But I will say for my testimony that we have a lot to do. Now that I'm in Liberia, I don't see the awareness. I don't see it here at all. Because even me that is here as a survivor, no one has recognized me as a survivor. And it's so bad for the myth and then for the treatment that we survivors have, because we need love, we need care, we need attention, but we are not getting it. What I would say is that in our own weak way, we will try to create the awareness that we can, whether support or not, because I tell you for free, the problem with cancer is not the cancer. The problem with cancer is the treatment and the finances. Had it not been God, I wouldn't have survived. The treatment is hard. The treatment is expensive. The chemotherapy is very, 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 very hard. And the radiation is another death trap. So the best we can do is to create the awareness to save lives. I am half metastatic, like Dr. Subo will call it. My right breast is gone. I only have the left one. And I got diagnosed when it was already under my arm, ready to spread to other part of my body. So it's just by the grace of God that I'm alive. And I tell God, thank you for the student community in China again, the Chinese government and the Liberian government. So I will not want to speak for long because I have another engagement to go to F4 Baptist, the youth. They are having another breast cancer awareness, and one of the doctors want me to speak there. But I will say to our sisters there in China, and those of us that have the connection back home, to tell our families that the goal is not only the breast, the goal is not only the foot, because there's a fellow that got amputated 2 days ago from diabetes, and that guy been in the church, and they said he had Goa until the diabetes has climbed up to his knee level, his knee, and he had to amputate the leg. Yesterday I saw him at JFK. So the myth also, and then the awareness, and then the love and care for the survivors, and even those that are victims will help us survive. But the best of all is the awareness, so that others won't go through what I went through. I hope you guys will have a nice night, and thank you for granting me the opportunity. Thank you.
Thank you, Kate.
Thank you so much,
Yeah.
Catherine.
You're welcome.
I'm ready to move.
I hope no one will
I'm
cry.
ready to
No
move.
one will cry there, because the cry is over. I'm alive and I'm here. I'm moving strong.
I'm crying. I'm crying.
It gotta be God for you, my sister. We thank God
Yeah.
for your life. No. Wow.
Okay.
Okay. So if we have any questions, ladies and gentlemen, you can put your hands up or you just drop your questions and we can refer it to our doctors that are here with us. Does anyone have a question? Okay. So we're gonna have a music. We're gonna have a music, but I think we are done with our doctor right now. Dr. Dede Superwu. If you have anything else to say to us, you can just say it. Are you there?
Yes, I'm here. So before I leave, I just once again want to say thank you for having me on the show. I appreciate the invite. I hope that I was able to teach you something. I hope someone was able to learn something new today. And I hope that we will use the information that we learned today and try to help spread the word in our various communities that breast cancer is real and that we should continue the discussion beyond today. Thank you, Dr. Bala, for thinking about me. Please, let me rest. Don't come after me again. Okay. Give me the next 1, 2 months to rest, because when the breast cancer you can come to me, yeah, I know.
Well, now one
Thank you for
question for
thinking
that.
about me.
You might want to be maybe oncology, I know.
Yeah.
Yeah, but thank you so much.
You be two things my horns up more than me, like when you talk about me.
And you need to end that studies and come back because I went to JFK and there's no oncologist that can treat me. Please come.
Yeah, so pray for me. Hopefully by the end of this year, I should be back in the country for good. So you pray for me. You pray let your people go. But yeah, thank you for having me on the show.
Okay.
And
Thank
I
you
hope
so
to
much.
interact with you all again some other time. Thank you.
Okay. So
Thank you
while you
so
are
much,
leaving,
Dad. We appreciate you being here, and thank you for they always responding to my call. Not just a colleague, but a friend and a sister. So thank you having you, and I won't let you rest. Except you decide to turn me away, and you don't want to turn me away. So yeah, thank you. Also, let me pass this because I may also maybe get just be hanging in and listening to you guys. Those of you who have families in Liberia, we're talking about breast cancer though, but there are many other cancers as well. Those of you who have family in Liberia, there is a screening going on right now at JFK for brain tumor, for brain cancer, and all other disease response are related to the brain and the spine. And so if you have any relative who having something in the spine, they're not sure of, who having something happening in the brain, they're not sure of, they should go to JFK. Like the door is doing this, he's currently there during screening, and they're going to be a neurosurgical orange next month. We have some neurosurgeon joining us from Canada and from America, and also from within West Africa to do some surgeries. That Dr. Doelung, even if I join him to also get finished doing this. So that's very important information for you guys to take note of. Yeah, thank you.
Yeah, and before I
And
go,
thank you
sorry
for
for
having us.
interrupting. Quickly before I go, if you want to get more basic information about cancer, I have my personal blog on Facebook. It's called Basic Cancer Facts. So with Dr. Subu. So there I try to share some simple information about various types of cancers, not just breast cancer. So you can just follow the page and just go there. I have videos, some short videos and other simple information I share on my page. Thank you. Have a blessed weekend. Have a blessed month.
thank you so much, Doctor.
Bye-bye.
While you leave, we are praying for you, okay? So that you can go back to Liberia and help our sisters, our brothers, moms in there. Okay, so do have a blessed day. If it is night, have a good night. Bye-bye. So Dr. Bala, back to you. We have a questions in our comment section here that says, as a preacher man and a medical practitioner, how well do you think we can tell our people to seek medical attention while praying whenever they are unwell? And that is from Catherine B. Marshall.
Okay. I think like the introduction when I am the visionary of the International Christian Medical Fellowship, and the vision behind that fellowship is that we can be able to use our Christian position to talk to people about medical issues. Of course, that's true. There are a lot of math within religious setting, not just in a Christianity. I'm a Christian, so that's what I'm saying, Christian. But there are a lot of math within religious setting that affects healthcare. And some people think everything that happens to the physical body is either spiritual, and you should not, seek medical attention early. You just pray and miracles should happen. But I think miracle is something that no man can do. There is no solution for it. There is no treatment. There is no cure. There is nothing you have to do about it. That's only God can handle it. Then as miracle. God has given wisdom. God has given knowledge to people. He has given skills, and it is a gift. It is a ministry by itself. And so the same way you will go to the pastor to pray for you, you will go to the pastor to discuss issue about your marriage so he can counsel you. Doctors, pastors, especially Christian doctors, they are pastors, and you should be able to also seek counsel from concerning medical issues. So like Dr. Super will say, most of the cases, not only breast cancer, most of the cases we see in hospital in Liberia is at the terminal stage. That's why a lot of people die. So people start noticing something abnormal. They don't go to the hospital, they go to the prayer band, they go all around, and when they're about to die, then they come to the hospital. And so the JFK is the tertiary hospital, right? Stay at JFK, most of the cases you encounter there, when they finish passing from all the clinics, all the private center, finish for all the money, they come to JFK, no money, and the disease is at the terminal stage, and you expect doctors there to perform miracle. We don't perform miracle in the hospital. God perform miracle. So as a Christian, I would say to you, when you're sick, if you, for example, you get malaria, you notice that you get malaria, you're having fever, yeah, it's good to pray, but there is treatment for malaria. Go take your malaria treatment. If you notice that there is something wrong with you and you get access to hospital, go to the hospital. Early treatment, early diagnosis, early treatment save your life. And God will be very happy with you because he gave the doctors the knowledge and the wisdom. And so if you have a pastor and a preacher who will tell you don't go to the hospital because God can perform miracle, I think that pastor is preaching heresy. Luke, who wrote most of the gospel, was a doctor, and Jesus himself, he didn't rebuke Luke from being a doctor, right? And the knowledge and all the great wisdoms that we have, we go to school and study is given by God. And so go to the hospital regularly, even sometimes you're not sick. I know in Liberia we don't do that, but it's very good. Go for your normal physical checkup, right? Usually in my Christian setting, I advise people to go for checkup at least once or twice every year, just to check your body and make sure everything is healthy. Missionaries, pastors, go to the hospital once or twice a year to just check your body because you're preaching, you're studying, you're busy praying for people. Go to the hospital and check regularly. The doctors are not enemies. The doctors are Christians. The doctors, in fact, are ministers. That would be my point I would give to that. Don't wait until the terminal point and you start praying for miracle for things that really didn't need miracle. I think the Bible says, lack of knowledge, my people perish, and also said, don't be foolish and die before your time. Sometimes some people die from some sickness, or we experience some death because of foolishness. That is, we wait and then we mess up, or we don't do the right thing and we want God to perform miracle at the right time. That would be my advice and respond to that question.
Okay. Thank you so much, Dr. Bada. Is there any other questions? If not, then I would like to call on 3 scholars for a remark. So if you want to give a remark, just put your hands up. Okay, so sorry for the bad network. Are you hearing me? Hello? Hello, is anyone hearing me?
We are hearing you. I'm hearing you.
Yes, we are hearing you.
I'm having a network issue. So is there anyone who want to give a remark tonight? Please call us are needed. Okay. Guinea, are you there? Hello? Okay, so let me give my own remark. Wow, all the people are getting ready. I would like to say thanks to Dr. Bala and our doctor that spent your time lecturing us today about breast cancer. It was